talk about kind of these symptoms, kind of chest pain, either typical or atypical, what other symptoms are we to look for then that kind of give us a sign that we need to go get checked out?
So in medical school, the first thing that we tell is, when someone has chest pain, like, you're worried about the heart. So that is a very, what we call a bookish symptom, right? You have a
Yeah.
crushing chest pain in the center of the chest, and then it might go to the arm, to your neck. That is the classic description.
Hmm.
Um, in females, in people who have diabetes, the symptoms might not be very classic. They can have
Yeah.
profound sweating, like, they say, okay, I'm not doing anything, I'm sitting watching TV, I'm just drenching in sweat. That's something
Yeah.
wrong. Or
Hmm.
there's something going on that we can't explain that because it didn't happen in the past, right?
Yeah.
You have this jaw pain, which is not very unusual. Sometimes people come with jaw pain saying that anytime I do something exertional, that means that, I'm walking and taking a flight of stairs, I start having this jaw pain.
Yeah.
Well, that's a sign that's very atypical, but again, you need to pay attention to that.
Yeah.
Sometimes people have palpitations, that their heart is racing fast. um, Fatigue, like, when you're doing things that you were used to doing, and all of a sudden, you know example is, like, I see people who come say, what, I can do like 3 4 flights of stairs without a problem, but
Yeah.
last 2 weeks I take a flight of stairs and I'm done, like, I'm not,
Yeah.
I feel like I'm exhausted, right? Which is not a usual thing. So those are the kind of unusual symptoms that, we need to pay attention to, especially
Yeah.
if someone has a predisposing factor, or if they have risk factors, like, if, if someone is a smoker, or someone has high blood pressure, has a family history, premature family history of coronary artery disease. If they have symptoms like this, I would be calling my primary doctor to see what's happening, and then, get checked.
Yeah. Yeah.